Hi, my name is Maddy Sortino, and I am a CDH survivor. I was born in 2004, so as of 2023, I'm 19 years old. And my parents found out their child was going to have CDH when in 2003 they actually just went in for an ultrasound to find out the sex of me. And in that ultrasound, that is when they diagnosed me with congenital diaphragmatic hernia. I had a much more severe case than normal. Only 16% of my diaphragm formed, so basically just that outer rim lining formed. You couldn't even call it a hole, like there was just nothing all the way across. So I was born at full term, but basically I was born and straight to the NICU. When I was 3 days old, I had my first major surgery. So they did the, horizontal CDH scar that everyone knows. They did that on my left side and puzzle pieced all my organs back to where they were. But before that, my abdominal organs were up in my chest. So my left lung was crushed and my heart was actually up in my collarbone. And just damaged my esophagus, acid reflux, that whole shebang. They left the left lung tissue in there just in case to see if it would grow. It's like maybe the size of a grape, not even now. So we still just kind of say I have one lung because the left side just really isn't doing anything for me. My heart was able to be placed back where it was supposed to be, and I don't deal with any like heart defects or valve issues, nothing like that. Today we didn't really deal with any heart issues, honestly, past like the first year of my life, so that was nice. But yeah, I had that surgery, and on the left side, since all my organs were up there, my ribs protrude on this side, kind of like a fishhook almost. The right side was pretty normal rib formation, but the left side pushes out all the way from like up to pretty much the base bottom part of the rib cage. So yeah, but staying backtracked, I had that surgery at 3 days old, and they used pigskin material to create my first diaphragm, and that held up for a little bit, but I think I had a couple repairs before the time I was like 5 or 6, and they started using that Gore-Tex mesh material. So now my diaphragm patch is Gore-Tex, like that's been talked about on the CDH page. I was born in Omaha, Nebraska, so all my specialty care has been done at the Nebraska Med Center when I was just a baby. But past that, I've had all my surgeries over the years at Omaha Children's Hospital. Dr. Stephen Rayner was my primary thoracic surgeon. He's done all my repairs, all my diaphragm repairs, and all the little kinks here and there. Recently, in May this past year, he retired, so Dr. Cusick, also at Children's Hospital, had been working under Dr. Rayner and had done surgeries with me when I was little, but now we have transitioned to him being my primary care, and he's done a wonderful job. When I was 12, I had pectus reconstruction surgery. That was a really big surgery because we were starting to see issues because my sternum, it wasn't in line properly just because of, all the rib cage problems. So my sternum was actually like sideways, but also pushing back down on my heart. So what they did was they broke my sternum to realign it properly, and then took out the whole like front cartilage part of your rib cage and placed a nuss bar behind the sternum to kind of hold my growing rib cage in place. and the cartilage, bone grows back, so the cartilage was able to grow back. Prior to that surgery, we had tried a clamshell brace, like kind of like a scoliosis brace, but we had tried a clamshell brace to like push down on my ribs on this side to see if it would kind of stop the deformation from growing further or maybe be able to push it in more. But we tried that for a year or two. It really hadn't done much for me, and honestly, it was very uncomfortable for me. I don't know. It was a lot of pressure on my chest all the time, and I wasn't very fond of it. But that's when we proceeded to do the chest reconstruction. And the hope was, since there weren't extra organs up in my chest, that it would grow back normal. But the left deformation did grow back again. So I'm not sure if we're looking to do future plans with it. It's not really causing any complications as of like my sternum pushing on my chest, like nothing like that's happening. It's more or less probably more of an appearance thing if I feel like I would be more comfortable without it. So we're not really sure what we're gonna do with that yet, but that was pretty big surgery in the summer when I was 12. And since then, I kind of plateaued a little bit. Like, we honestly thought we had kind of jumped all the curves of CDH. But in high school, we had a lot of complications come up in here and there. The summer after my freshman year, it wasn't more or less a complication, but I don't know, it's something that just isn't really talked about with the CDH world. And we had to battle insurance with it because it wasn't something they had really seen, or they didn't exactly deem it like health risk necessary. But because of my chest deformation, my breast on the left side was kind of pushed out more than the one on the right side, and it was very, very obvious with like swimsuits and shirts, and I couldn't get bras to fit me the right way. Like it doesn't sound like that big of a deal, but it really impacted my life a lot. And for my own mental health too, it definitely took a toll, just because in middle school all these girls are going through puberty and everyone's bodies are becoming permanently how they're gonna look, and I was just there with like very noticeable unevenness in my chest. So I ended up having a saline breast implant put in on just the right side to kind of become level with the left side. So like the breast tissue itself was the same size, but because of the rib protrusion on the left side, it made the left breast push out more. So having an implant on the right side helped even that out, and I mean, it made a world of a difference for my mental health with feeling good in my own body. I'm able to wear swimsuits like normal, like shirts actually look normal on me. Like you wouldn't know anything's wrong with me, and it was much more noticeable prior to that. So I had that surgery my summer of freshman year. But then in 2020, it was fall, winter of my junior year. That's when, I don't know, just thing after thing started coming up. I was having a lot of pain, just widespread across the diaphragm area. And it was, I could feel it when I breathed. It was very uncomfortable, and it was just an aching feeling that was always there. So we got it looked at, and for a little bit, for like a week or so, we just kind of watched it on and off, but I ended up being in and out of the ER for another week because just the pain would come really bad and then subside a little bit, then come really bad, and eventually I wasn't able to keep food down. Like it just kept coming back up, and I was just very uncomfortable. And eventually, another time we went to the ER that week, they ended up doing a contrast CT, and that showed that I had a hernia. That showed that my patch had torn and I had re-herniated. and there you could see like a knuckle of my intestine that had pushed through that was kind of up in my chest a little more. So they were like, okay, it's go time, we got to get this fixed again. So this was beginning or middle of October of 2020. Children's Hospital, went in, had the surgery done, and when my surgeon went in, he actually thinks I had had this hernia for honestly probably a good year, because it ended up being the size of a softball. And for whatever reason, it had just now started acting up, but he was shocked with how big it was. So they replaced the Gore-Tex patch, and we thought we would be smooth sailing again, but I had that surgery recovery, so I was in the hospital from that for about a week. We got out of the hospital, I think we got out of the hospital on like a Monday, and like Thursday or Friday we were back in the ER, and I just had excruciating stomach pain. Like it was worse than the pain that was going in my chest. I had never felt that kind of pain before, and they did an x-ray, and they were actually like, immediately they were like, hernia, like something happened with the hernia again. But they looked at the x-ray, and I had a huge bowel obstruction in the left upper quadrant and one in the lower right quadrant of my stomach. And it was like blinking, and like everything was happening. I had that x-ray, they admitted me, scrubbed me down, and it was like a span of 15 minutes I was into the OR, because they were like, we need to get this now. Because of all the scar tissue from all my previous surgeries, the scar tissue had like kinked around 2 spots, and I had already been backed up from the surgery meds from the hernia repair, so they needed to get in and clear that out. So I had an NG suction tube for almost a week, and for that hospital stay I was in for about 2 weeks, and it definitely took a toll on me mentally. I had never experienced bowel obstructions before, and for one, the tube, placement of the tube was a mess. It was a very scary thing for me. And I was in the middle of my junior high school year. COVID had also been going on that whole year, so that was definitely a surgery stay to remember. But we did recover from that. So 2020, that year, I had a hernia repair and bowel obstruction surgery. So 2022, my senior year, again, figured we were smooth sailing, but almost exactly a year later from my previous hernia surgery, in November of 2022, I had another hernia tear. Basically, same thing. I actually called my dad in the middle of a school day crying, and I was like, I think I have another bowel obstruction. Like, this hurts really bad. Something's wrong. Like, something's not right. So I don't know, for some reason my brain was thinking bowel obstruction, but we go in, go in the ER, do another contrast CT, and they're like, yep, you have another hernia tear. Not as big as the one before, but it was there. My intestines were trying to move through again, so another surgery that year. Instead of, because at first the idea was to maybe just close up the hole, but instead they just added more Gore-Tex mesh material. So since then, no hernia problems. That was 2021, I'm sorry. That hernia surgery was 2021, which was a year after my 2020 hernia surgery. So I think we're smooth sailing. 2022 comes around. I get through senior year, and this past summer, so summer 2022, had a really bad pain in my stomach again. I was home this time, but I went up to my dad. I was like, something's not right again. Like, we gotta go get checked. And we go in, and I had a minor bowel obstruction, and this time they didn't want to they didn't think it was severe enough where we needed surgery or anything. So they actually admitted me probably like 5 or 6 days, put me on NPO, so no foods, had me on IV fluids, and it did clear out itself. Week and a half goes by, the pain is back. We go back in again, get another x-ray, and they're like, yep, we can see another bowel obstruction. And again, they were like, I don't think it's severe enough where we need, it was a little more severe than last time, but they were like, it doesn't need immediate surgery. There's a chance this can clear out on its own. So they put me on NPO, and we had done that for about 4 or 5 days, and the pain was still there. And they kept doing x-rays every day, and they still were like, it's not like cutting off circulation or anything. It's there, but it's minor. But my surgeon talked to me and was like, this is kind of a decision for you, but we could do a laparoscopic procedure, try to laparoscopically tear out some scar tissue, see if we can clear some things up. It's not necessary right now, but it might be something where you can avoid these complications in the future. And he was like, again, this is up to you. This isn't like a life or death thing you have to do. It's just maybe we can avoid complications, because the thing with bowel obstructions is once you have that scar tissue, you're always prone to it. So they pretty much explained to me, you could have another bowel obstruction in 2 months, you could have one in 2 years, you could go through the rest of your life without having one again. But my brain was just kind of thinking, I decided that I thought we should do it because it was such a mess to have to deal with surgeries in the middle of high school years. I was like, especially for college, I want to avoid that. So we do the laparoscopic procedure. I have another NG tube, I'm on NPO. Stayed in the hospital for about a week with that and sent me home. Everything seemed okay. When I was home, this time it was only, like maybe 3 or 4 days. But when I was home, my parents and I were noticing, we were like, my stomach isn't getting softer. Like, honestly, it looks like it's just getting like bigger and harder. So we think there's more stool buildup going on. We were a little worried. And in the middle of the night, I woke up, really bad pain, super nauseous. I couldn't keep anything down. I ended up laying in bed with my mom, and she watched me for the night. And we wanted to see if maybe this was something we could just wait out. Like, we just got out of the hospital. We weren't looking to jump right back into it. We call my surgeon, and we were like, what do you think we should do? And he's like, I don't want you to go to the ER. You know how much of a mess that is. He got me into his clinic that day. And he's like, bring her to the clinic. We'll do an x-ray. I'll examine her. We'll take steps from there, see what's going on. We go back. This time I had a full bowel obstruction. And this was like a 10-minute process. They were like, we're admitting you to the hospital. I was like, okay, here we go. So I get admitted. They're like, we just need to do a full open surgery again. Laparoscopic just didn't do it for you. We just need to do it again. So they go in. This time it was a longer surgery stay again because they wanted to be overly cautious. It was again, took a toll with my mental health just because we had been in and out of the hospital for like pretty much like the whole summer. It was just a mess of whatever was going on with my stomach. We don't know what was going on, but got that repaired, and it is now, about May of 2023, and I have been smooth sailing since then. But yeah, high school was definitely, we don't know why my body just kind of had a bit of a breakdown for a couple of years, but high school was a lot. Junior year, I had a hernia and bowel obstruction surgery. Senior year, I had a hernia surgery. Summer after senior year, we had 2 bowel obstruction surgeries, but at the end of next week, I can say we made it through my whole first year of college without any complications, so that's always a plus. And now I am happy and healthy. I am studying nursing at the University of South Dakota, and this sounds very specific, but I actually want to do med-surg nursing at Omaha Children's Hospital just because that's where I've grown up, and my heart is just kind of like I want to give back to that, and I want to help kids like me because I feel like I can sympathize and empathize with them on some levels that other nurses may not be able to. So those are the goals for me. But yeah, there's been a lot of obstacles. I mean, granted, I had a 5% chance of living. I had a G-button feeding tube for 12 years, all these different kinds of inhalers, lots of lung monitoring, just little things here and there, you know, suppressed immune system, bad immune system, all the things like that. But I don't know, I just haven't really seen CDH as a way to stop me or limit me from things. I don't know, I see it as my little superpower. It empowers me to be like, yeah, I have this, but it's not stopping me. I'm proving the world wrong, just doing things that normal people do. So, yeah, I mean, overall, it's been a roller coaster, and I know the roller coaster isn't over, but I'm very happy with life, and I wouldn't change a single thing that's happened. And honestly, all these things have led me to find my passions in life, you know. Not, like, I don't know. I don't know if I'd be so interested in the medical field, or especially pediatric nursing, if any of this had happened, you know. Like, it's really giving me passion to do the things I want in life. And now I am helping with CDH International. I'm gonna be a social media ambassador, so I am always here as a person to give advice, talk you through. You know, I kind of understand the perspective for CDH from my parents as a survivor. I've talked to parents who have lost children, so it's bittersweet to be able to be a person that can relate to the whole CDH community on all ends. So I'm very grateful for all the things I have in life today, and I am hopeful for the future and hopeful for the future of CDH. So yeah, thank you, and if anyone has questions or just needs to talk with someone relatable, I am always here.